Welcome to Convergence Healing with Peter Bedard, where we empower you to heal your pain on every level of your being, body, mind, spirit. Our show is about sharing solutions for creating the life you want. We invite you to stand up and choose a life of health, happiness, and joy. And we're here to show you how. This is Convergence Healing.
And hey everybody, welcome back to another episode of Convergence Healing with Peter Bedard. I am Peter Bedard, your host du jour, right? Yes. And we're here because, you know, my focus in doing this show isn't about me being a superstar, although I think that would be great, right? Why not? I like how you do that little shoulder little thing. But it's really about offering people solutions for healing because, you know, part of my gold in the garbage is that I struggled with pain for decades. You know, my personal story is I had tons of chronic pain, physical, emotional, and spiritual, and I had to heal myself, and I had to figure out how to do that. And if it wasn't for people making suggestions to me, the only things that were really in my awareness were drugs and surgery, and I didn't want to do those. So I just suffered for a long time. And people every now and then would say, hey, I met this great healer who does fill in the blank, and I'd just go. I would just blanketly trust that if it worked for them, it could potentially work for me, and I would go. And the healing I experienced in so many different ways was phenomenal. I mean, I did all kinds of incredible things. I did everything from iridology, which is taking the photograph of the eye and making it really big and actually diagnosing the body through what's going on in your eyeballs. And yeah, pretty neat. And I've done these little computer things and these computer models and biofeedback and energy and shamanic work, all kinds of stuff. And I found my healing in things that the doctors told me I could never heal. And that's huge. And it's the driving force behind why I'm here for you. Because I want you guys to actually heal. And I want you to have solutions for feeling better. So please leave us your comments. You can leave comments on SoundCloud and on the Reverie platform. You can also find us on Stitcher and iTunes. And we really want to know what your thoughts are, or if you're struggling with something, because I will actually find an expert. If you tell me, hey, I'm having a difficult time with fill in the blank, I will then go and look for someone to have as a guest on our show that could help you with that particular issue. So leave us your comments. Let us know what's going on in your life. We really do want to hear from you. And with that, I always like to start my episodes with a quote. I find quotes to be extremely inspirational. I love them. I read them all the time. I even will do a little search online for different things because I find that other people's life experiences and their words impact me greatly. So this is a very short quote from Thomas, I don't know how to say his name, Szazz. It's Szazz. I don't know. But this felt so right to me, especially with our topic today about mental illness. And Thomas says, in the past, men created witches. Now they create mental patients. Mm-hmm. And men created witches in the past, and now they create mental patients. And there's a wonderful shaman that says that all those people that are in mental hospitals are shamans in the making. You know, and that to me is a great way to look at mental illness. It's somebody that's struggling with a particular issue. And as they come through that issue, just like the gold in the garbage, they are our next generation of healers. So that pain that they're going through, in this case, it's mental pain, thought-based pain, is the thing that is transforming them into shaman. It's transforming them into the wisdom keepers of the world. And so I wanted to introduce you to Dr. Gayani. I met her actually at a shoot that I was on when I was on a different show, Remade in California. Mm-hmm. And I saw her and I liked her message so much that I actually wanted to bring her on my show. And so without further ado, here's Dr. Gayani.
Hi, Peter. I'm so glad to be here.
Thank you.
You know, reading your work, I completely believe in Convergence Healing.
Oh, thank you. Wow. Okay.
And using what other people's experiences are and what their thoughts are.
Right.
This is how we heal, and we all can heal.
Yeah.
You said that your doctor told you that you could not heal. And
You
that makes
really
me-
did read my book, didn't you? Wow. Yeah, or part of my story. Thank you.
Well, that makes me so sad to hear
Right.
because as a physician, I absolutely identify with being a healer.
Mm-hmm.
And I identify with my patients as healers also in their own right. I just wrote a book,
Right.
which is coming out in June.
Congratulations.
And it's all about how to be a healer parent. So I fully believe in that we can heal
Right.
ourselves
Yeah.
and we can help other people heal as well.
And the story that Dr. Gayani is referring to is years ago when I had an accident. Somebody drove me into the back of a semi-truck and I died. In that experience, afterwards, the doctors told me that I would never be able to walk again. And if I could, it would be very difficult and I'd have to have my knee replaced by the time I was 40. And I told them to screw off. I had other choice words for them, but that's the most proper way of putting it. But that message stuck in my subconscious. And when I was 39 and a half, I was walking from my garage to my front door and my knee literally popped on me. I heard it. It was so loud. And it swelled up to the size of a football. And the doctor said, oh, well, you're going to have your knee replaced. And I said, this is ridiculous because this isn't my truth. This was the doctor's truth. The doctor had an opinion. It snuck into my subconscious. And because he's an authority, I believed him to a degree. But I also knew that it was, even though I had physical evidence of all that pain, I couldn't even put weight on my leg. It was literally the size of a football. But I knew deep inside me that that pain wasn't real. It was just his belief that got stuck in me.
Right. And that pain also gave you information about your knee. And as you listened to it and felt it and didn't get scared of it, you learned more about your knee and what it needed.
Absolutely,
to heal.
Yes.
And, when I see patients, I'm in mental illness. I'm a psychiatrist. I see mental illness as a brain disorder. It's complicated because it has that psychological component as well as the neurological component.
Right.
And so as I sit with my patients, children, adolescents, young adults, and older adults as well, I hear their pain. I hear them talk about their psychic pain, their mental pain, and they often have physical pain associated with it.
Right.
One of the most common symptoms of depression is actual physical pain.
Physical pain, aches. Yeah.
And some people can't even get out of bed because they have so much depression.
Been there. Absolutely.
It's actually called leaden paralysis. The neurology actually paralyzes their body because they're so depressed. So this is their emotional state, their mood state, their illness that's causing this paralysis.
Right.
And as they come out of their depression, that paralysis also lifts.
Right.
It's not. Sometimes it's hard to understand if you haven't been that depressed, like what that really feels like in your body.
Well, we were talking with an earlier guest that was on the show who's talking about migraines and how, it's an invisible illness. And it's the same thing with mental illness. Most of the time, it's invisible. And most mental illness that you see people walking around with, or you don't see people walking around with, you can't know unless they're doing something really obvious or they're doing something that's like acting out, like they're speaking to no one that's there or something like that.
And many people put on a mask as they walk around.
Yeah, absolutely.
So inside
I did for years.
Right? Many people do that. So even if they're struggling with suicidal thoughts, which are not something that they can control, they still put on a smile and they go about their business and they meet with family and friends and they say everything's okay, but actually inside in their mind and their body, they're struggling with, I don't want to be here anymore.
Yeah, I did that for years. I would call it the Sisyphus effect. So Sisyphus was the king of, I don't remember where he was the king of, somewhere over there in the Grecian area. And Sisyphus cheated the gods of death. And he actually locked Hades up in a closet, basically. And the problem was that nobody was dying. So Sisyphus wasn't dying. He didn't have to go to Hades, but everybody else, on the battlefield, the warriors are walking around with gushing wounds. Nobody was dying. And that was a bit of a problem. And they finally, let Hades out of the closet, and Hades took Sisyphus down to Hades. And every day I would wake up feeling like Sisyphus, because his story, his punishment for defying the gods was that he had to roll that big boulder up the hill. And so every day his task was just to roll this giant rock. He's the one that you see that's normally very burly, and he's got this big boulder, and there's lots of, famous paintings about that type of thing, of him rolling that rock. And every day I would wake up, I would feel like I was being punished again. Mm-hmm. And every day it was just waking up was rolling that rock up the hill. Right. And boy, did that suck. And I wouldn't tell anybody.
No. It's hard to, because who can relate?
Right.
But the truth is, most people can relate.
A lot of people can relate.
If you can talk to people and express yourself and be vulnerable and disclose really how bad it is for you.
But I don't think, at least around me, people said they wanted to know, but when I would tell them, they didn't know what to do with it, or they really didn't want to know. They would lip service of saying maybe they really did, but they just didn't know how to deal with
I think it's
like
more
that,
they don't know how to deal with it, because when you hear somebody else's pain or their experience of pain, it reminds us of our own pain.
Yeah, and very much.
And we have lots of defenses against that, because we really don't know how to deal with pain.
Right. And everything in this culture, this is my soapbox, right? Everything in this culture is about not feeling pain.
Right. We have to put that happy face on.
Take that drug, right?
Be happy.
Do this, be happy, whatever it is. And God, that's bullshit.
It completely is bullshit, because...
And that was a doctor.
Yeah, well, you have to call it as it is.
As it is. It is what it is.
It is, because life is not about being happy all the time. Life is about creating relationships, having a relationship with yourself that's authentic, having relationships with other people that's authentic, really knowing who you are, knowing who somebody else is, creating that space with others. So that you can get to know them, and they can feel safe to get to know you and allow you to see who they are. I really think that's what life is about.
I agree.
And that's not just being happy all the time. You can't get to know someone deeply if all you do is have a good old time with them.
Oh, I hate that. I can't. So you are hitting so many points for me that I'm like, right? I talk to my clients a lot about the spectrum of emotion. Right?
Yes, absolutely.
And it's this vast variation. Like, you could think of a color spectrum, right? Where there's so many different shades of one particular color, right? And if you think of that as each color is an emotion, which actually there's some really fascinating science that's about color and emotion and that type of thing. But if you look at the emotion spectrum, I find this in LA, and this is just my being superficial, but I call it... there's a superficiality that comes from, say, mid-LA to the west side.
Okay.
And it kind of sticks around the coast more, right? And it's this idea that you have to be happy all the time.
Oh, yeah.
And people make their world smaller and smaller and smaller and smaller.
Like, you can't be blue.
Right? No, you can't be blue.
Have the
blue. You certainly can't be green, You have to be pink all the time.
But we are green sometimes, right? We do have jealousy and envy, and we want what the other person has sometimes.
Yes, and there's nothing wrong with it.
No,
it's just an emotional spectrum.
Right, and it changes.
It does change.
We can be at any point on that spectrum at any given time.
In one day. I mean, we can hit
in
all
a
of them.
moment.
Yeah.
Sometimes we have 3 or 4 of the same that we know of, which can get confusing.
Yeah, so there's this sort of spiritual materialism, and these people create these worlds that are smaller and smaller and smaller, and they cut people out of their world, right?
Right, to distill our emotions, to understand that moment. But our moment is much more complicated than that, much richer. And if we can allow for that richness, and part of it is accepting pain and allowing it in. Many years ago, I did a meditation with a wonderful monk named Ajahn Brahm in Australia. He was in LA. And he said, you know what? One of the things you can do with pain is invite it in.
Yes.
What does that mean to actually invite pain in?
That's a great concept.
So he said, let that pain come in, welcome it, say, you know what? Come on in more.
Yeah.
Let me feel more pain.
I'll go even further and say love it.
Love it.
Love your pain.
Yes. And what does that mean, really, to love your pain?
Well, for me, it means that part of me that's hurting, my relationship that I was taught to have with pain, right? The relationship that's in our culture around pain is to avoid.
Let it go.
To
push
ignore
it away.
Push it away, shove it down, and then stop it, tell it to shut up. And then we go even deeper with it in the abuse, and we punish it and we make it wrong and bad and we want to beat
spread
it
it
up.
around, right?
Well,
to
then
other
we spread it
people.
around to other people, and the pain is never really getting addressed. It's just actually expanding.
Right.
But when we love the pain, I don't know about you, but if you were my pain, and if I said those horrible things to you, right? Like I don't want to say them to you, or just not to her. But
I might get worse, right?
Right. Or you
might fight back.
You fight back.
Right.
Yes. If you're anything like me, you're gonna fight back, because if I'm your invisible friend, pain, and I'm with you 24/7, and I'm walking around with you,
that's right,
and you treat me like crap,
you're gonna want to be loved.
I'm gonna smack you around even more. I'm gonna be like,
Yes,
you
you
think
will.
you're hurting now? Just wait.
And it's the same thing with depression, with
Yes.
anxiety, with bipolar disorder, with mood states.
Yeah.
It's all of that, the confusion. If you try to squelch it, stop it, push it away,
It builds power.
It's going to fight back because it is part of you.
Survival.
It's part of us. And if we can treat it like a friend, love it, it can give us information.
Right.
Information about ourselves, information about what we need, information about how to have loving relationships with other people.
Right.
So, and it is a part of ourselves. And so if we hate a part of ourselves, what does that do? It creates shame.
Yes. And what message are you sending to your biology?
Exactly.
You know?
It sends the message of feel more pain,
Right.
feel angry, have low self-esteem. People feel so shameful sometimes that they cut on themselves. They hurt themselves.
Yeah.
They want to die. They have those thoughts of suicide. And it all stems from this feeling of shame, of hating a part of yourself.
Right.
Wanting to get rid of it, but we don't have to get rid of it. Anxiety, for instance, can be your friend.
Yes.
You know, sometimes
yes,
it gets
It's
overwhelming.
there to do something for you. That's my
right.
point of view.
It helps you. It helps motivate us, right? It helps get things done. It helps get things done well. Because imagine if we didn't have anxiety,
Right.
we might just whatever. We
whatever.
can just
Right.
lollygag through life. But we have something to offer.
Yes.
We all have something to offer, and so our anxiety motivates us to offer whatever it is that we have.
Right. It's like a calling.
It is. It is. It's an internal calling of go on, go give, open up your mouth, say what's on your mind.
Yeah. Now, when anxiety gets to that stage of chronic, you know.
Yes, it can get debilitating.
Right.
It can, when it gets to the stage where people have panic, that is a
And
chemical.
let's just say if it gets to that stage.
If it gets to that stage.
Yeah.
No, many people don't get to that stage, but
Yeah,
some
right.
people do. And there can be a genetic basis to that. So it runs in families.
Sure.
It's hereditary. And that's really a chemical
Right.
imbalance. And that's when your nerve cells, your brain, can't produce enough of a
feel-good
neurotransmitter
chemical,
like serotonin or dopamine, oxytocin, and it just can't. It just doesn't reach the threshold
Right.
to relieve that pain or relieve that anxiety. So the anxiety kind of boils over.
Right, and the panic attack is from my point of view often a good thing, because it's a big eruption, it's a big venting
It is.
of the stuff that's been shoved down.
It
so
can
at
be,
least
yes.
it can drop down the level. It certainly doesn't feel good when it's
No, it feels
happening.
awful. It only lasts 20 minutes.
Yeah.
It's really temporary.
Right.
And if you can breathe through it, that's one of the techniques to
Right.
manage a panic attack without medication. So breathe very slowly, 10 times at least. Slower, slower breathing until it passes. And it always passes.
Always does, yeah.
So this is another thing about pain, right? Is that an anxiety is that it creates fear, which is not real.
Right.
It's a
perceived,
construct.
right.
It's a thought construct, and we get afraid of the panic attack lasting longer than it really does, or we get afraid that we're going to have another panic attack. But really, what happens during that panic attack? Your heart beats a little bit faster, your breathing gets a little shallow, you might feel a little tingly in your fingers, you might feel like something bad is going to happen, but nothing bad is actually happening.
Right.
You're not having a heart attack.
It's a projection.
It's a projection. You're able to breathe still, and the tingliness is just your nerves trying to manage all of that adrenaline.
Yeah, I had my first panic attack when I was 21, I think, or 20. Somebody had hired me out of the blue to take over an entire division of a commercial and print agency.
Sure, who wouldn't have a panic attack? That's a lot of
I was like,
responsibility.
well, of course I said yes, but I had no mentor. Unfortunately, this was in the 80s, and so there were people dying all over the place because it was the Bay Area. For AIDS was just wiping out whole groups of people. And here I am thrown into this agency, where I'm supposed to be in charge of these people's lives, their career, and trying to get them work and all that type of stuff. And oh my God, I literally thought I was having a panic attack.
That's tremendous
I thought I was having a heart attack. Like I felt it in my chest, like my heart was about to explode.
Was part of that not knowing if you could do it?
It was a lot of stuff. It was not knowing if I could do it, and it was not having the tools to do it. There was no support. So I was 20, 21 years old. I had no idea how to run a commercial division of a talent agency.
Yeah, so your anxiety was telling you, hey, I need some help here.
Get out of here. Yeah. And so I know it that firsthand. I know what that experience is like.
Sure.
And I literally went to the hospital thinking that I was about to have a heart attack.
Yes, many people do.
Literally thought I was having a heart attack.
Yeah, it feels like that because your fear makes you believe that.
Yes.
You know, I think it's kind of like women going through childbirth.
Right.
You know, that pain, I don't know.
Or men
I'm
going
sure.
through childbirth thinking that they're having...
or passing a kidney stone,
right,
you know.
Yeah.
You get these waves of pain,
Right.
and it makes
like
you so
how you
scared.
put a kidney stone with having a kid.
Well,
I agree.
you know, passing it, it's,
Yeah.
whenever you pass anything, it's
I don't really
painful.
want to do that. No, thank you.
But the pain comes,
Right.
you know, and it peaks. And just as you think, oh my gosh, I cannot handle this anymore. Right. It's going to be horrible. I can't handle it. I'm going to die. That pain goes away.
Yeah.
It just goes away.
Yeah.
And then it comes back.
Yeah.
And then it goes away.
Right.
And then after a few cycles of that, you've got a wonderful little gift.
Right. So when we come back, we're going to take a short break. But when we come back, I'd really like you to share some more concepts. Like for me, when I was able to change my opinion about mental illness, because growing up, when I was a kid, you know, they were Reagan was closing all of the mental hospitals,
Yes.
right? Everything, all that horrible stuff, and they've never recovered.
Right.
So you have more and more people that need help that aren't getting it, that are living on the street. And I had an idea that mental illness was a weakness. You know, this was when I was a kid, because that's what I was taught. If these people were only stronger, then they wouldn't need the government to help them out, right? So close the hospital down. They're just weak people, or that bullshit.
Totally.
Right? Total bullshit.
No. We
But
are
that
all
idea-
susceptible to mental illness.
We are, and I would like you to sort of, when we come back, sort of dispel some of those myths
Okay.
about mental illness, and you know, about what it means to be mentally ill and what actually is mental illness.
Sure.
Okay, thanks so much.
thanks.
All right, we'll be right back. Stay tuned, and yeah, that's it. We'll be right there. Hey everybody, thanks so much for tuning in. If you're interested, check out convergencehealingteas.com. You can try all of these yummy, delicious teas that are actually crafted in my home kitchen to help you feel better. We have a Sleep Well blend, a No More Anxiety blend, and all of those ingredients in there are designed to help you feel better through the traditional qualities that Mother Nature has to offer. Check it out. Hey everybody, thank you for staying tuned. We are here with Dr. Gayani, and we had a couple questions, or I had a couple questions about mental illness and what actually is mental illness, because as we were saying before the break, I had this idea growing up at the time where, you know, in a conservative area, and how everything was being shut down and all that type of stuff. When I was a kid, they were closing down all the mental institutions and doing that type of stuff, and people were just being thrown out onto the street.
Right.
And it was a pretty horrible time, but that's not changed. You still have people living on the street, even from those 40 years ago, 30 years ago. And mental illness was looked upon, in my understanding, as a weakness of character, a weakness of spirit, or something like that. And I think that is greatly wrong.
It is completely wrong.
Yeah. So talk to us a little bit about that.
So mental illness is a brain disorder. It has a neurological basis. It gets complicated because of the psychology is also integral to mental illness. And there's this wide range of what we consider mental illness. We've sort of dumped in situational blues or depression or sadness and some situational anxiety with what we consider the clinical mental illness. You know, those of us who treat patients who have mental illness with medication and therapy and all the other modalities that are out there, we see a more severe kind of mental illness than what the public might be thinking.
Like that's out of my scope. I don't handle that type of stuff.
So, I mean, when Reagan shut down all the mental institutions, he let that group, the really severely mentally ill people, he left them without services, without help. We're trying to reinstitute different programs around the country and around the state. Not doing a great job of it, I have to say. I wish there was much more help for the chronically mentally ill and profoundly mentally ill. They're still not getting enough services.
Pretty much any service out there. When you go to Skid Row, these people they're getting, some of them are getting some sort of medications if and when they can get the medications.
Right, and there's so many details with that. So many issues with that. That there's a lot of work to do to try to get services and have them have access to mental illness care, mental health care. But I think understanding that mental illness is a brain disorder is really critical to move us from this idea that mental illness is a defective character. This is not a defective character. It is a biological, neurological illness that has manifestations in behavior, thinking, feeling, interacting. It really impairs all aspects of somebody's life when they have a mental illness. The stigma of mental illness, that's what you're talking about, really, about thinking that people who are mentally ill have a defective character or some kind of weakness. They don't. Every single person on the face of the planet is susceptible to mental illness.
Well, and the actual number of people that are affected or have mental illness, I think in the U.S. there's a statistic, something like 116 million people a year have some form of anxiety.
Well, in adolescence, it's somewhere up around 70% of adolescents.
Wow, it's that high.
Have reported either having suicidal thoughts, significant depression or anxiety.
Absolutely, yeah.
Yeah, I mean that's a huge.
So talk to it. Let's say being our community that this show is made for is primarily LGBT, right? The platform, the Reverie platform, is exclusively made. We call it queer-rated content, right? And so it's content that it comes from the LGBT community that is then curated or gathered together and put out on the Reverie platform.
So the LGBT population, their risk of suicide is three times
super high.
3 times the other population.
And I thought about it when I was a kid. Absolutely. When you're getting that message that who you are is wrong and bad, and you get it constantly, but you don't know why, and there's no evidence as why you're bad.
There's nothing wrong with you.
There's nothing wrong with you. Yeah, exactly. So the audience that's listening, I'm sure, has struggled with a lot of these issues on some level. And is there any advice you would give to somebody who is maybe not that they're even seriously about it, but that they're thinking those thoughts and that scares them? What do we tell them?
Well, what I want to tell them is to seek some help. Yeah. Definitely don't keep it inside.
Like what kind of help?
Any help.
Any help.
So anything like that
pastoral help.
Pastoral help. Help from friends.
Psychological help, psychiatric help, depending on how severe you are.
Any kind of help that is actually positive and validating and in tune with how you're feeling. So the kind of help that says, oh, you're wrong, let's change you, that's not good help. That's not help. That's terrible. Run away. Turn around and go seek somebody else. But seek help from people who are open and kind and compassionate and who have the ability to accept everybody and who can, actually give of themselves and their heart to help you.
One of the things that really helped me in coming out of that space was I tried traditional psychotherapy and I just didn't get it. I did traditional. I think postmodern psychotherapy is much better now, but this was, 20, 30 years ago. And the type of psychotherapy that was out there at that time was very different.
Well, unfortunately, in our field of therapy and just the psychotherapy rhetoric and theology, not theology, theory is very conservative and hesitant to be accepting. And I'm not sure why that is, because to me that just seems completely opposite of what we're trying to do. We're healers. We want to help people feel better
an openness
and feel good about themselves.
Anything that works is
So, but historically we have been very not me, but
which is one of the reasons because you're very progressive. So the traditional psychotherapy for me, I would go and it was just they would just keep asking me, so what's your story?
Yeah, and what's your problem, right?
And
You're not a problem.
Right. And that's all we did is talk about my problem or about my pain, and just kept repeating the same thing over and over and over and over again. And I just thought, I don't want to do this
What a waste
anymore.
of time.
But the
really.
science around that is really interesting, that you're basically digging, in layman's terms, you're basically digging a deeper neural pathway. The more you tell that story, the more it becomes your dominant understanding of life. And I was just telling a story about how nobody loves me, everybody hated me, I just want to eat some worms. That was the story.
Well,
Poor me, poor me, poor me.
Well, your therapist didn't help you rewrite that story.
No, not at all. It wasn't until I found non-lettered, when I found people that were more similar to you, who are more tuned into the spirituality of wellness, the spirituality of health, the mental health. And that's when where they started teaching me meditation and mindfulness, and that I'm not my thoughts, and different concepts. AA was huge, even though I wasn't an alcoholic. The ideas in the AA Blue Book were really amazing to me, because they talk a lot about obsessive thoughts, obsessive thinkings, and all that type of stuff.
And learning your own truth.
Yes.
And learning what that is, figuring it out, writing your story from that truth.
Right.
Not from somebody else's
truth. Who you
truth.
really are, not
But from your own.
Yes. So what would that be as an exercise for somebody? If somebody's listening right now, and I try to be really practical, what does that mean to write your truth?
Well, first is, don't be afraid of what you're fearing. So try to understand your panic, try to understand your fear, try to understand your pain. What is it? Don't be afraid.
So let's be really, really practical. If somebody's listening right now, does that mean they should grab a pen and paper and write down those thoughts, or what's that?
Sure,
what
you could do that. You could
understand?
journal it.
Right.
You could keep your mind open. I know people say, face your fear. But what does that really
What
mean?
does that mean? Yeah.
I don't know. The fear is right in my face. I'm having a panic attack.
It's there all the time. What do you mean?
Of course, I'm facing it.
Right.
But what it means is saying, maybe actually taking a step back.
Right.
And saying, whoa, let me look at this fear.
Right.
Let me look at what I'm afraid of. What is it exactly? Am I afraid I'm going to get hurt again? Am I afraid I'm going to have another panic attack? Am I afraid that if I get close to somebody, they're going to cheat on me?
Am I afraid I'm not going to be loved?
Am I afraid that I'm not going to be loved? Am I afraid that some part of me is not right?
Right.
Am
And
I
that's
afraid
huge.
that this is wrong?
I'm afraid that there's some part of me that's wrong, and that there's that at my core I am fundamentally bad.
Right. And so what I'm saying is, try to understand that. Don't push it away. Don't try to avoid it. Don't judge it.
Right.
Just say, okay, I'm afraid that I might be bad.
Right.
Something might be wrong with me. I'll tell you a story. Actually, it's a personal story.
Okay.
When I had my child, I was trying to learn how to nurse and breastfeed. One of the most helpful things that the pediatrician told me, because I was having a little bit of difficulty with it, was, you have to realize you're not giving your child anything bad. There's nothing bad coming out of you for your child.
Right.
And that really affected me, because I thought, I didn't realize that's what I was thinking, but I had been thinking about that. And it created a lot of anxiety for me. It created a little distance. I was so nervous about breastfeeding. And then when she said that, I thought, that's true.
Right.
There's nothing bad about me. I'm his mom. I'm fine.
That's beautiful. That's awesome.
So, and it went much, much better after that. It was easy after that, actually.
Right. I call that holding space, and how I describe that with my clients. I call that, it's just like this experience of, there's the pain. Are you going to engage with it, or are you just going to hold space with it?
Right.
Yeah, and that's kind of that stepping back.
Right, and looking at it and saying, acknowledging it, right? Saying, yeah, I do have that fear.
That's there.
Yeah, and then you can understand it and move forward.
Right. I try to describe it as if your best friend came to you and was really hurting, and you're not going to do what most people do to the part that hurts, right? They want to beat it up or make it wrong or bad or ashamed of it or whatever. Your best friend is now in the room.
Right.
And so most of the time, if our best friend's hurting, we just listen.
We listen. We offer them a hug.
Right.
We offer them space.
We even say, what do you need? What can I do to help you feel better?
That's understanding your fear, what you're afraid of.
So that's something people can actually do.
Yeah,
right?
absolutely.
So hold space for the pain, maybe write down something about it, let it
Share
be.
it. Share it with other
somebody
people
else.
so you can get that feedback.
Right.
You can get that nurturance from others.
Right.
So
I try to sort of drive that home because so many people are talking about stuff but not giving. Sometimes we just need to have that sort of practical, okay, do this,
Right.
right? Pull out the paper, grab your pen, and just describe the pain.
Yeah, describe it.
Just describe it. There's no need to engage with it. There's no need to fight with it or argue with it. Just witness it. Just like if your best friend came into the room and you were just there with them and you're observing them.
You don't have to engage your feelings with it and create drama about it.
Exactly. That's huge.
Yeah, because that drama just, feeds it and fuels it and makes your fear even worse.
It perpetuates it.
It perpetuates it.
Right.
Yeah. Right. The other thing is to believe that you can heal.
Right. So that's big. So how does somebody actually do that? If they have all the evidence in front of them so this is a concept I want to share with you. Okay. So they have all of the evidence in front of them that says that they are wrong or they're bad or they're not going to heal. If it's a physical thing that they have this tumor and the tumor is only going to give them so many weeks or months or whatever it is, right? And they feel a particular thing, right? So if it's anxiety, they feel that panic, or if it's, some other disease, they feel exhausted or whatever it is, right? They have all this evidence, what the doctors told them, like in my case, the doctor had that opinion about my health, right?
I think that's key.
Yeah.
It's an opinion.
It's an opinion.
So I approach any kind of statement like that, be it from one of my contemporaries or from my son, anybody, my parents, with criticism, not critical thinking. Right. So I think, whoa, why are they saying that? What evidence do they have to say that I can't heal?
Right.
Where
or that it's always going to be like
That's
that.
Always
How
be
do
like
they
that?
know that? They're not God. They're not some,
right? They know as much as I know.
Right.
I can go read about it. I can go get a second opinion. I can think about it for myself. If it makes sense for myself, then I might think, okay, well, maybe that makes sense, what they're saying. Maybe I can take it.
Right.
But if I disagree with it or it doesn't jive with me,
right.
You don't have to accept everything somebody tells you.
Right. So I call this positive denial.
Yeah, that's a good word.
And that came to me from working with with the clients that I worked with who have cancer issues. Because they have so much quote unquote evidence that is telling them what their life is like or going to be like, right? From the blood reports to one person's opinion to another doctor's opinion to their family's opinion to, their relatives that are already digging the grave for them and, trying to get them to write their will or whatever it is, right? All of those are, and the way they physically feel, that's all the evidence that says to them they are going to die, right? Now,
what about all the other evidence?
Exactly. And what if we put that evidence of pain in the corner? What if we it's not about ignorance, about saying, okay, that's what they say. That's even maybe how I feel right now. I know that if I keep giving that energy, right, on this sort of etheric level, if I keep giving that my thought, my opinion, my feelings,
that's the path it's going to take.
That's what's going to happen.
Right.
So what if I put that in the corner and positively denied it? I get it's there. I'm not engaging with it.
Yeah, it's there. It's somebody's opinion. It has the same weight as something else.
Right.
But if you like another opinion better, if it resonates with you,
right.
You have to believe your gut too.
Yes.
Yes. Our bodies, our minds, our feelings. Like we know ourselves better than anybody else. Even the oncologist, even the psychiatrist. I tell my patients all the time.
Me too.
I can only understand you as much as
you say it
as
much
you
better
tell
than
me.
I say if there's some bullshit that I'm saying that you don't agree with, you can tell me that anytime.
Oh, I say that all the time too.
Do you? Yeah, this is just my idea. So
yeah, and my idea is based on the interaction I'm having, the feelings that are resonating in me, what they're saying, the knowledge that I have.
Right, but I don't have to be right.
You know what? Most often I'm not. My patients are right. And actually, I had a professor in medical school say to our whole class, if you listen to your patient, no matter like how convoluted their story is or whatever your facts are, your patients will always tell you what's actually wrong with them.
Right.
But you have to listen. You have to learn how to listen for that. And so I do that. I had in my first year out of medical school during internship, I saw a patient who had paranoid schizophrenia. Ooh. He was an elderly gentleman. He was like 80-something, and he had been at the hospital for quite some time before I got there.
Right.
And the nurses complained about him. He was up and down. He was complaining that he had a delusion. This is what the thought was, that his neighbor was coming to the hospital and stabbing him in his side, in his chest. And so I was with a medical student, and I said, you know what, let's go talk to him, and let's see what this is all about. So we talked to him, and he said, oh, my neighbor, he's just stabbing me in my chest right here, and it hurts so bad. He keeps stabbing me. And I said, okay, well, let me see. Lift up your shirt and let's see it. And so he did. And I looked at his chest, and I palpated it with the medical student. I said, let's do a physical exam. Let's treat him appropriately. Let's listen to his concern. And, I remembered what my professor said, that your patient will always tell you. And this was a paranoid schizophrenic guy who was extremely delusional. Right? And I looked, and I palpated his chest, and sure enough, there was a gigantic tumor.
Oh, my.
It was visible. And it was obvious.
Right.
Nobody could have missed it if they had just pulled up his shirt, right? And gave some credibility to his complaint.
Right, and that's the only way he could understand or explain.
Right, that was the only way.
With his condition.
And so, he was on the oncology floor the next day and in surgery the day after that.
Right.
He told us.
You just listened.
Yes.
And so on that note, we're going to take a little break.
Okay.
And I'm thanking you guys for listening, and we will be right back. Hey everybody, thanks so much for tuning in. If you're interested, check out convergencehealingteas.com. You can try all of these yummy, delicious teas that are actually crafted in my home kitchen to help you feel better. We have a Sleep Well blend, a No More Anxiety blend, and all of those ingredients in there are designed to help you feel better through the traditional qualities that Mother Nature has to offer. Check it out. Hey everybody, welcome back. We were chatting so much on the break that I forgot to even get us back on live. So we're having such a great conversation between the two of us, and I really appreciate you being part of that conversation. It's important for me, and one of the driving forces why I do this. I don't get paid for this work. Maybe I will one day because I look forward to that. But this is just part of my life passion. It's part of my purpose where I've healed myself of so many things, and I want people to know that they can too. And so the guests that I bring on the show are really people who are in alignment with that and offering solutions. It's not just us, we're having a good time chatting with each other. It's about really offering solutions to people. So let's go with your tip that you just mentioned while we were on the break, because I really like that. And to explain what you said gratitude, and to explain actually what gratitude is, because people have this idea, I'm supposed to say, thank you for the trees, thank you for the sky. There's this kind of rote sort of blah.
It's not real.
Right.
Really just say thank you. It's meaningless, just a couple of words.
Right. But so tell us, I like your opinion, your approach about this. What does that mean to really be thankful?
Well, to be thankful, to appreciate, to be grateful really means to think about what's going on right now and appreciate the nuances and the details of any given moment. So one of the things that, there are three things actually about appreciation that are important to me. So three things to remember about appreciation. One is to ask yourself, who's the most important person here? And here, when I think about that, I think, well, Peter, you are the most important person, and your listeners are the most important people. Okay. Now, if I were by myself, I'd think, okay, I'm the most important person because I'm here by myself.
Right. I would think that the most important person would be you and my listeners.
Well, I'll get to that.
That's interesting.
Yeah, so it's kind of, I think it gives credence to appreciating that we are in an interaction.
Right.
We are in this moment together. The second thing is, what's the most important thing to do in this moment? And that is to care.
Yes.
Really care about this moment, because
loving kindness.
These moments go away. And once it's in the past, you know what? There's nothing we can do about it. It's gone. All we have is right now. And then the second thing is, when is that time? It's right now. Because that really is the time to care and the time to acknowledge what is important. And the thing about appreciating all of these details is that it gives us a chance to do something, because we all have something to offer. and we have a chance to make a connection and do something that is beyond ourselves.
Right. And that's huge, something beyond ourselves.
When we do something that's beyond ourselves, it gives us satisfaction. It feeds our ego, which is a good thing. It's not a bad thing.
And that idea of the ego needs to be crushed. Oh,
no,
I can't stand
we
that.
need our ego to feel good
Just
about
to
ourselves.
get out of bed, I need my ego.
Absolutely. We need to present our ego to other people, right?
Right.
And help them heal and make that connection. And so when you do that beyond yourself, you can have that sense of self-esteem. It builds your self-esteem.
Right. What's something that would be, what does that mean to be beyond yourself? What would that be?
That means feeling that connection. And there are actually therapies that are based on this idea.
Oh, fascinating.
Like, for instance, dialectical behavioral therapy,
Right.
which is Marshall Linehan designed this from CBT, which is cognitive behavioral therapy,
Right.
which takes your thoughts and your behaviors and makes a connection, and then you can make change.
Right.
But dialectical behavioral therapy takes that another step, a little deeper, to rely on a connection that you make with another person to help you feel grounded and help you understand your feelings, know that your feelings are grounded. And it all relies on that connection to another person. And then it helps you not hurt yourself, really.
Right.
It's for people who struggle with anxiety and shame and the feeling of wanting to die, wanting to harm themselves. They don't like themselves. They're not connected to themselves. But connecting to another person, being beyond yourself, really helps build that connection to themselves and that solidness inside them. It puts something into that emptiness.
Right.
So those connections are so important to help us feel, to heal, to combat pain, to combat all the struggles that we have.
Right.
It's connecting to other people.
That's beautiful. So that is our primary focus. I think that's your biggest advice for today to offer people, right? There's so much you offer us, but that biggest one is just connecting to people, finding that loving kindness, finding that appreciation for the moment, connecting with yourself.
Right.
Right?
Yeah,
on
absolutely.
a deeper level.
It's not about pursuing happiness all the
Right,
time.
right.
It's about making those real connections.
Right.
And those real connections do happen in sadness.
Oh, the pursuit of happiness is exhausting. That just,
It's really a waste of time.
it really is.
And a waste
I'm
of
so
energy.
glad to hear you say that. That's awesome. So tell people how they can find you. How can they connect with you?
Well, they can connect with me on my practice website, www.lagunafamily.com. I am coming out with a new book in June, a psychiatrist guide.
Great. And what's the title?
A psychiatrist guide helping parents reach their depressed tween, which will talk more about making connections with your teenager and really becoming a healer parent,
Right.
learning how to think about yourself, connecting to yourself as a parent, and knowing that you can heal and believe that you can heal. I want to empower parents to be able to do that, and then transferring that empowerment to their children, and helping them heal in their crises and in their depression and
That's
anxiety.
great. Well, maybe we'll have to have you on again when you have that next book out.
I would
Take a
love
look
to
at
be
that.
here back.
So tell people, are you on social media? We connected with the website, but can people find you on Instagram or Twitter or Facebook?
They will. It's not up yet.
Not up yet? Okay.
I'll let you
great.
know.
All right. And you have a hashtag. Let's just put that out there in case people want to send you a message.
Okay, hashtag Dr. Gayani.
Dr. Gayani, spell that for everybody.
DrGayani.
Perfect. Thank you so much.
Thank you, Peter.
And thank you, everybody, for listening. We really appreciate connecting with you, and we want to hear more of what you have to say. So, as I've said before, leave us your comments, and we will find people that can address your pains, your concerns, and the life that you are creating. Thank you so much. Stay tuned for our next episode, and we love you. Bye-bye.